Everybody, so welcome all to the summer seminar series in the PreMed Scene Journal Club. My name is Christina Wera, and I'm the director of the club. And I am going to take you through a 5-part series in Journal Club. So what is that? It's going to be a series of 5 videos on the ins and outs of learning how to develop research literacy. So how to read, understand, and analyze medical research. And my goal for this series is that by the end of the summer, you'll all have some new skills in your back pockets to either take with you into a world of research, as in-person research opportunities are now opening up, or to just take with you through your upper level undergrad or grad courses and eventually into the world of medicine. So the PreMed Scene Journal Club serves high school, undergrad, and postgrad students who are interested in any careers in medicine, whether it be nursing school, medical school, dental school, PA school, or any other health-related grad school, such as psychology, physical therapy, and the like. So will this be too repetitive for those of you with undergrad or other research experience? Not necessarily, although some of you have been fortunate to learn about research and lab methods, and even some of you have had some clinical research experience in healthcare settings, you'll still be able to benefit from learning about the process that comes afterwards, which is writing up the results, and the analytical and the translational methodology that comes with that. Because of course, the scientific method involves a whole process. It's not just the experiment itself, right? So, I mean, we could do all the research in the world, but we need to also interpret those results and properly translate the results into the real world clinical medicine and improve it over time, or else it wouldn't really have much of a point, right? So for those of you with research experience, although some information may overlap, this will still be very beneficial. So my 5 short videos will be on the dates listed on the screen. This video, of course, is the first, and each video will probably be between 10 to 15 minutes in length. That'll just cover some of the high yield topics in research literacy, although I won't be able to cover everything. And each video will be successive. So watch them in order if you started this late. Because particular skills and stages will build upon each other. And so all these videos in this series are going to center around one article. It's a very recent study. It just came out in the New England Journal of Medicine, which is a high impact, prominent medical journal. And the study itself is called Tympanostomy Tubes or Medical Management for Recurrent Acute Otitis Media. So that sounds like a mouthful. I know that's a lot of medical terminology. And if you don't completely understand that title yet, it's okay. That's why this seminar exists. But if you have access to this article through your academic institution, your school, or your workplace, go ahead and get that in whatever format you want. But if you don't have access, I know a lot of high school students may not, then email me at the email on the screen and I will get it for you. I want everyone who follows this seminar to have this study to look at and read throughout the summer, okay? So, and that brings me to the next point, and it's a pillar in my teaching. If you have any questions at all, please email me. I really want each of you who tunes into this series this summer to understand and learn from this. So if you don't understand something, just reach out. I always say to my students, the only stupid question is the one that isn't asked. I'm here for you. That's the whole point of this program, for you to learn. So otherwise, I'm just talking into outer space, and that's no fun. So I want to help make a difference in your learning journey. So what's the PreMed Scene Journal Club in the first place? It was actually born last year from the pandemic out of a collaboration of a journal club that I had started and the great folks at the PreMed Scene, the leadership team there. And with the hardships that came with the pandemic, we found ourselves in last year, where we identified a big gap in research learning opportunities, which are important in medical education. So this is when our journal club was born. We put our heads together and we structured this new journal club, not like a continuous journal club as is traditionally seen, but it was shaped in the form of a semester-long program. And it fosters research literacy and critical thinking. And it runs on a semester basis, approximately 3 to 4 months. Our first term was this past spring. It went from the beginning of January to April. And let me just, as an example, take you quickly through the calendar from the spring. This was our syllabus here. And the program went from, like I said, the beginning of January to April. Okay, so the beginning of each month, all students voted on one out of 5 or so articles that I picked out. The winning article was the one that we read and we studied for that month. Then in the middle of the month, I have a workshop for the whole cohort, and it's either based around the pathophysiology or the medicine surrounding that particular condition in that study, or just some information about that type of research study and the research methods so that you can just understand the paper a little bit more as you dive into it. So then after the workshop, the students get together virtually in small groups of about 5 to 10 students, and you discuss the article. You compose together a short presentation, like 5 minutes long, that just covers one aspect of the study. And I'll give this example to you to see what the groups could be covering in a particular month. And then this rotates each month, all right? So they only cover one aspect. And then that general schedule repeats itself each month. See, it repeated itself in February, and then it continued in March. And then in April, the small groups gave their final presentations. So they chose one article together as a group to present, and then they covered all the aspects of the study so that they could practice learning how to read, analyze, and succinctly report on an entire study and put it all together. So we are going to have a fall term. It'll probably start in December and go through December. And the registration, I'm assuming, will probably open up at some point in August. So if you are interested, subscribe to thepremedicine.com so that you can get notifications so that when registration opens up, you can register. And we would love to see you. All right, so here's the summer seminar schedule, right? Okay, so today I want to talk to you about why Journal Club is even important. What's the whole purpose? July 1st, I'm going to talk about the context that surrounds the study, which is actually really important and very relevant. Then on July 15th, I'll talk about what the investigators actually did in the study, right? Get really down into the meat of it. On August 1st, I'm going to discuss the results the investigators received from the study, like what happened, right? The last couple of pages in a really good book, like this is going to be fun. And then on August 15th, which will be the last seminar, I'll bring it all together and discuss the conclusions. And that's kind of like the epilogue in a book, right? The very last part, what they think this study really meant, and what lessons, if any, we can take away from the study to help us in caring for patients in the future, and what this might mean in the greater world of medicine. All right, so why is Journal Club important? Well, like I said before, journal clubs improve research literacy. What's research literacy? Well, it's the ability to read, understand, and analyze published medical research. But why is it even important? Well, it's really in the center of learning and practicing evidence-based medicine. And that is structuring medical care around up-to-date data on what is the most effective treatment for our patients. So there is a lot of medical research out there, and there's a lot of new medical information. Just think of all the new technologies, the treatments, and the discoveries that are made every day, every year, right? It just piles up. And it's actually been said that the amount of medical information, which first took 50 years to double in 1950, it's now taking a few months. A few months. It's crazy. So you may or may not know, but medical treatments and therapies are discovered every day around the world, and they're published and they're analyzed in these medical studies in medical journals. And so they're born from clinical experiments that test new therapies with conventional treatment. And then over time, they can possibly change medical practice guidelines. So for example, what regimens would you put a patient on when they come into your office with high blood pressure? Well, that depends on a lot of factors, and there are guidelines for that. Those guidelines have been established from these cutting edge studies, and the guidelines take you through, what to look for in your particular patients. It's not just the number of the blood pressure, but it's other medical issues that they may have, or even their age and race. There are so many different treatments out there. So it's these guidelines that are based on clinical studies that are going to guide our medical care for our patients. All right, so long gone, obviously, are the days where a medical professional should just tell a patient what to do. That was called paternalistic care because they thought that was the best choice based on their experience and their opinion, right? Now, there are so many other factors to consider, like using gold standard clinical research findings to determine the optimal care for our patients. But of course, evidence-based medicine isn't perfect, okay? There's both good and bad research out there. So we need the skills to be able to discern the difference just for the sake of our patients, right? Because we always want to put the patient first. And that brings me to another point. We also need to understand, no matter how much research is out there pulling us towards a certain therapy for a patient, we also have to understand the context, the life situations, and the values of our patients so that they too can have a voice in their own medical care. So say, for example, someone may not have insurance, and so medication or therapy might have to be modified based on what they can afford. As another example, someone with diabetes might follow Ramadan, right? Might be Muslim and have Ramadan and wants to continue to follow the fasting tradition of Ramadan. And so we have to work with them. It's really our responsibility to work with them so that they can fulfill their values and still be healthy. So we can modify their diabetic medication during Ramadan when they're fasting, because they need to have a voice in their own medical care as well. So that structure of care, that ongoing conversation we must keep with our patients and our respect for their decisions is called shared decision making. So it allows us as medical professionals to guide them with the best medical evidence out there, but ultimately it gives them the choice to what they want as care. And so I think the biggest take home message is that, medicine is just a profession of constant learning, with both all the information out there that we need to learn constantly and the continued growth over time that we will be involved with, and how to make good medical decisions and communicate effectively with our patients in numerous situations. Because of all that, a commitment to lifelong learning isn't just desirable in medicine, it's really crucial. So even though many of you would like to get involved with research or academic medicine, many of you may not, and you don't necessarily need to be a part of lab experiments. But you have to understand that those experiments are necessary. So you don't necessarily have to, partake and be a purple minion, but you have to understand why the minion's purple. All right, so let's dive into the paper. So this is what the top of the first page is going to look like once you pull it up. The study is about ear infections in children. Okay, that's what acute otitis media is. It's a middle ear infection. And it basically compares the treatments of antibiotics, which is medicine, versus the surgical procedure of placing tubes in the ears, and then assessing what the outcomes are going to be. So they're going to come up with a conclusion of which of those treatments is better, all right? So like I said, please reach out to me if you need a PDF version of this study. My email again is on the bottom left in red. So that's it for this week. My next video is going to dive right into the study, so put your swimsuits on. We're going into the deep end. And the series will be coming out in a couple of weeks, July 1st, so stay tuned. And if you aren't subscribed already, subscribe to both our website at thepremedzine.com, press that red subscribe button below, and opt in to receive notifications so you can join us for the rest of the videos in this series. I will see you here in a couple of weeks. Take care.